Welcome to Public Health Matters, where we talk about matters in public health. My name is Jane Goodman, Public Health Strategist with the Nashua Division of Public Health and Community Services. And I'm joined here today by Epidemiologist Angela Consentino. Welcome, Angela.
Thanks, Jane. Thanks for having me.
Well, thanks for joining me on this cold winter day. We're just going to start with a COVID update because we're always talking about that first. And then we'll talk about some other things at the division that are going on for a little breath of fresh air.
Sure, sounds good.
So so for our audience, we want to give you an update. The last update that we gave you was 2 weeks ago. So globally, we have 105 million cases of COVID-19 and 2.1 million deaths. In the United States, we've had 26.7 million cases. Almost a quarter of the cases that are reported worldwide are in the United States, and our deaths are at 456,000. And our sympathies, of course, go to those who have suffered a loss in your family or any of your friends. Looking at the COVID data metrics for the city of Nashua, we have 5,895 total cases to date. 304 active cases, which is a little bit down from last week, which is a breath of fresh air again for us.
Yeah, this number is actually pretty down. So we've decreased about 50% in the past 2 weeks in regards to our active cases. So this is great news for us.
Yeah, so it keeps us a little less busy on the phone, talking to people and that kind of thing. And also people are healthier, so that's the most important part. New infections per 100,000 are 593.1. And just explain what that number means, Angela. We see it a lot, but this number has also declined dramatically in the last couple of days.
Yeah, so this is essentially the incidence rate, which is the number of new cases over time. And here it's 14 days. So we should start to see this past week's decrease in those case counts reflected in this incident rate probably around next week or so. So we should probably see a pretty significant reduction in this number next week. And this number has been decreasing pretty rapidly over the past 2 weeks. So we were at about 900 new cases per 100,000 at the beginning of, or at the end of December, beginning of January. So that number has definitely decreased significantly and is really reflective of new cases of disease that pop up.
So, and we use these data metrics for very specific reasons. We choose to show these over and over. The schools use them, our community uses them, and so they're different. They're color coded, which we like to do so people understand. Are we green? You know, is it a green light, yellow light, kind of caution, slow down, or red light? And so we also see that our new hospitalizations per 100,000 is fairly low at 3.4, and our test positivity rate is at 7.0%. So that gets us in yellow, at least for, so I mean, I'm thrilled. I like the graphics person, so I like when I get to change colors, especially for this. So we're in a yellow range. When do we get to green? Is it below 5% or?
So for the yellow, for the 7-day total test positivity rate, it's less than 5. We're in the green. And then for new infections per 100,000, less than 100 is in the yellow, and I believe less than 50 is in the green. So we use these 3 indicators sort of together to paint a picture of what's going on in the community, specifically in regards to community-based transmission. So community-based transmission really means what's happening in the community that we don't know. So a person goes into the grocery store and they get sick, and they don't know that they got sick at the grocery store. They just know that they're sick. They're not sure where they got sick from. So that's community-based transmission. So it's very difficult to track. It's very difficult to predict because people don't know where they got sick from. So we use these 3 indicators together in tandem to kind of show us what community-based transmission is looking like in the area. So The green is there's minimal community-based transmission. The yellow is there's moderate, and the red is there's substantial. So we're still considered substantial community-based transmission because there are so many new cases per day. And that kind of alerts us that we need to be cautious when we're out in public, continue to be cautious in public. When it's down to minimal, when we're in the green, you're pretty safe when you're out in public. The risk of community-based transmission is low.
Yeah, so I'm looking forward to changing the colors on this graphic. And we can both attest, having spoken to families and spoken to people, I can't even tell you how many times I talk to people, like, I don't go anywhere.
Yeah.
I go to the grocery store, I come home. I went to the doctor's office, I went home. So, maybe people aren't remembering where they've been, or they have done something else, or we're not sure, but I think it really speaks a lot to the community-based transmission.
Yes.
That people just really don't even know how they're getting this.
sick,
So we know it's in the air. So we go to our first graph. We have the case counts per week. And I will give credit to Angela because you made this graph. And I did ask you to make that last bar orange because it was kind of exciting to see such a huge drop in case count.
Yeah.
Finally, we've been really in the higher numbers. As you can see from the far right of the graph, the bars are really high. And then finally, at the end of January reporting, we're kind of 2 weeks behind where we are, right? Is it 1 week behind? Is that January 31st? So through the end of January.
Yeah, so to this past Sunday.
Yes.
So we do it on a week by week, Monday to Sunday. And so last week, really, we reduced by half. So I'm expecting next week, we're also probably going to be low. We're not seeing a whole lot of new cases come into the division. We're able to revisit our surge protocols and kind of address all high priority cases, which is great. So I'm expecting to see the number of new cases continue to decline into next week, and hopefully that's a trend that continues throughout the winter.
And that should continue as long as people continue to take precautions. So, a little shout out to keep your Super Bowl parties non-parties and watch with your family and your bubble. And we've kind of gotten through the holiday surge, which we expected. It also was very predictable, so we knew that was going to happen. So we know that large events, more than 10 people in a poorly ventilated area, or even just in a family room, you're more likely to spread virus.
Yeah, and we do know that viruses have seasonal transmission patterns. So we followed the seasonal transmission pattern of pneumonia and flu when predicting COVID-19 seasonal transmission patterns. So going forward, we can kind of predict a spike in the fall and then maybe potentially a little bit of a rise in the spring. So we'll see what happens. And then once this full year is over, we'll have a good idea of what the COVID seasonal transmission patterns are like.
Yes, and we really want this year to be over.
Yeah.
Just a little aside.
Yeah.
So our next graphic is the percent positivity in New Hampshire versus Nashua. I like to show that Nashua tends to run a little higher. We're a little bit more densely populated than the rest of the state, so we do have those differences in numbers. But also to say that one of the benefits of having our own public health department is that we can look at the city as a whole, and we can kind of monitor our own community and kind of put out that alert that, the transmission is still going on. So when we look at the state, they're at a 4.6% positivity rate, and they are green. No, they are, I marked them green today.
I think they are green.
Okay.
Yeah.
So I hope I did that right.
Yeah.
So it's up there green. And our Nashua 7-day average, we like to do a little equation that makes it easy to understand. We've had 30 positives over 429 tests, and that's an average for the week. And so we're at a 7.0 positive test rate, which, having seen it at 13%, 12%, 11%, we're doing much better than we were in weeks past.
Yes, and it's been steadily declining for the past week or so that's great news.
Yeah, so then we just want to continue with our reminders of when to get a COVID test, because we're not out of this yet. So we are on the decline, but as events occur in our community, what do we call them on our call this morning? Drinking holidays or something. We want to make sure that people are still cautious. So, please get a test if you do have symptoms of COVID-19. Those include the loss of taste and smell, cough, shortness of breath, fever, congestion, runny nose. There's a lot of symptoms: nausea, vomiting, fatigue, and muscle aches, or if you've been exposed to COVID-19. And can you just explain what an exposure means?
Sure. So an exposure is being within 6 feet of a positive COVID-19 case for 10 minutes or more. So if you are exposed to a person who you know is sick for 10 minutes or more within 6 feet of them, regardless of wearing a mask, you should quarantine at home. You shouldn't go to work, and you should get tested. And we recommend people get tested 3 to 5 days after they're originally exposed, so that the virus can be caught in their system.
Yeah, so, and we also ask that if you are going to go get tested, please do not use the emergency room for testing. Call your primary care provider. You can call the Division of Public Health. We do have a clinic on Tuesdays, which we will continue as long as there's need. And testing it continues to be one of our biggest defenses against the spread and mitigation of this. Just again, we always emphasize this, that personal responsibility continues. Stay home if you're sick, except to get medical attention. Wear a mask when you're in stores. We still have a mask mandate in the state of New Hampshire through March 26th. That may be extended. We don't know, but at least through the end of March. Avoid large and small indoor gatherings. Keep a distance of 6 feet from those not in your family. And wash your hands often. And if you don't have access to soap and warm water, we all know there are lots of little mini-size hand sanitizers. So just, grab one of those, keep it in your pocket. Just do that, especially after you've been out, been shopping, those kind of things. And then finally, we do have a COVID testing clinic every Tuesdays from 3 to 5 p.m. We've moved locations. It's at the National Guard Armory. You enter on Veterans Drive. It's 154 Daniel Webster Highway. You can schedule a free test appointment. You can do that online, or you can call our COVID hotline, 589-3456. And we do prefer you have an appointment for that, just because it makes it much more efficient for us and for you to get through the line. So now that we've done our COVID stuff, we thought it would be really great to talk a little bit more about what the division does. So yes, we are super busy with COVID-19 and managing this pandemic and the mitigation strategies and all of that. But there's a lot of work that we've started to pick up behind the scenes to continue being the chief public health strategist for the area. And we wanted to talk about the fact that we're the only accredited health department in public health in the state.
Yes.
So we're always very happy about that. And I believe we're in our 4th year of our accreditation, and we have to renew that this fall.
Correct.
So we are busy at work.
Yes.
On other things.
Yes.
So just to remind people, we do provide a range of direct services, engage a variety of partners on strategic initiatives to ensure the health and well-being of every member of the Nashua community. And when I say Nashua community, I mean Greater Nashua. And we have a map that can pop up later when we're talking about some of our other projects. Our mission is to promote and protect and preserve the health and well-being of the Greater Nashua region through leadership and community collaboration. So even as we work through the COVID pandemic, we're certainly not doing this alone. We partner with the hospitals, we partner with community health centers. We work with so many different agencies around the city to manage our efforts. And that continues, and that happened before COVID too. So maybe you can give us an example of some of the collaboration before COVID.
Yeah, so a really great example of when we really pulled together as a community was with our opioid response. So we have our mayor's opioid task force, which has different stakeholders across the community, different people across the city, and we even had, parents and families involved to address the opioid crisis and the increasing rates of overdose in the community. So that was a really great example of when we convened stakeholders and pulled together groups of people to address the public health issue, to set goals and to track our progress. And so that's a foundation that we built when we address the opioid crisis that has sort of transferred into COVID and has also transferred into other public health initiatives, like, for example, suicide prevention. So we have seen suicides increase drastically in Nashua and New Hampshire for the past 4 or 5 years. So we did the same thing. We convened stakeholders, set goals and objectives, and started to work. And so it's kind of like a plan, like a foundation of how to address these issues with a community group. So we did the same thing with COVID, and we'll do the same thing with our strategic initiatives. So our community health assessment and our community health improvement plan and all other community-based strategic initiatives, we'll pull together community partners and stakeholders and also residents of the city and the region.
So it's really a group effort. At Public Health, we kind of just...
Yeah, and really the goal is we're all rowing the boat in the same direction so that we can have impact on these issues. And the best way to do that is with a community focus.
Yeah, so again, I just review, we consider ourselves the Chief Public Health Strategist. And as you said, we have a little graphic again, convene the right group of stakeholders to set a vision for health. And it's our collective vision, not the Public Health Department's vision. Assess status and needs, agree on strategies for change. We lead the implementation, and we track impact. And the tracking impact really comes back to a lot of your role, Angela, as an epidemiologist and looking at the data and making sure, like, if we have an intervention as a community, what do we see before and what do we see after?
Yes, exactly. So we have a lot of different ways that we track the evaluation of public health programs. So every program is different, every initiative is different. And so we just keep track of our data and the community's data and reflect on it, and every so often adjust what we're doing to reflect what the data shows us.
Great. So it's really always moving. It's very fluid. We always kind of do and check, I should say. So just a little bit on being an accredited health department. So yes, we're very proud of that, but what does that mean? So we are judged against a set of nationally recognized practice-focused evidence-based standards, and we have to do it within a specified time frame. And it's a continual, like you just said, a continual development, revision, and distribution of public health standards. So what they want on a national level, we try to reflect on a local level, looking at the data, reflecting on it, making changes to our programming, seeing pre and post, and being a little bit fluid.
Exactly. And there's different requirements that come with accreditation. So part of accreditation is development of the community health assessment, the community health improvement plan, the strategic plan, the performance management and quality improvement plan.
Oh, you're making me sweat.
So there's a lot of strategic planning behind being an accredited health department and also tracking progress. So it's really making a plan, doing the work, following through, moving forward. That's what they want to see when they accredit a health department.
Yeah, so we'll talk about those individual projects. So so for people to understand what this means for Nashua, we have a map and we have these public health networks. We do include Greater Nashua, so a region, I believe there's 13 towns.
Cities and towns, yes.
Yes.
So Nashua's the city, and then there's 12 surrounding towns.
So I did get the number right. Yeah. That equals 13. But those surrounding towns, so that's really important for people to understand. We're not just here for the city, and we have a lot of partners out in the community. So that brings us to our Public Health Advisory Council.
Yes.
And their role is a network of organizations and individuals. They work collaboratively to improve the health of the Greater Nashua Public Health region. And we couldn't do it without them. We actually use them for guidance and voting on certain issues and what's important to their agency, what's important to the community. We do that through our meetings, which are all Zoom right now, but we're getting through. And in different ways, you and I have been trying to brainstorm on how to creatively engage people while on a Zoom call, but these issues will be all brought up soon.
Yes.
With our Public Health Advisory Council. Let's talk about the Community Health Improvement Plan.
Okay.
And this is something that you and I have been working on just to get launched.
Yes.
We're not quite launched yet, But we have, as part of our accreditation, we do have to have a community health improvement plan, and it is exactly what it sounds like. It's looking at the health of the community and how we can improve it. And we look with data and different types of data, whether it's a focus group, qualitative data, or if it's quantitative, different metrics that maybe the hospitals are collecting or different area agencies, and we aggregate them, try to make sense of them as a group. And then set goals around those.
Yeah. So the Community Health Improvement Plan is really the goals and objective settings for community-based initiatives. And then we use the data that was collected in the Community Health Assessment to inform the priorities that are selected during the Community Health Improvement Plan. So it's really a cycle. So every Community Health Improvement Plan, you set goals. Then you have a community health assessment where you review the health of the community and see if you made any progress on those goals. Then you make new goals and objectives in the next community health improvement plan. And then you evaluate those in the next community health assessment. And then you make new goals, and it's just reiterative process. Yes.
And how often do we do the community health improvement plan and the community health assessment?
It's on a 3-year cycle. So we had the 2017 community health assessment, and then we had the 2018 community health improvement plan. This year we'll have the 2020 Community Health Assessment and the 2021 Community Health Improvement Plan.
And then we'll have accreditation at the end of the year.
Yes.
It's really a perfect storm this year.
Yeah, this year a lot of things seem to be happening at once.
Of course. The year we have like no time to do it. But that's okay. We're going to do it. It's a lot of fun actually to pull the community partners together. And we're very fortunate. We get to work with a lot of really bright people that really are passionate about the health issues that they work in every day.
Yeah.
And so that representation is really critical. So we developed that collaboratively. It's not our plan, it's really for the community. Again, I just want to reiterate that. And then we do, again, have that map of who we serve, if we could put that up, so that people kind of see that this, if you're sitting in Merrimack, or you're sitting in Hollis, Mount Vernon, we are serving your community as well.
Yeah, and we really do strive for representation from these communities. So we try to get the police, the fire, the health officers from these communities engaged in the development of our community health improvement plan. And we also have regionally based services that serve not only Nashua, but the surrounding 12 towns. So we try to really focus not only on Nashua, but also the 12 surrounding towns.
And you can see that. You can hear it even in our office when we have just done a vaccine clinic with Hudson AMR, for example. So we definitely have these partnerships with our surrounding towns. So just briefly, I wanted to talk about this. We love acronyms in public health, the PMQI, almost messed it up. I had all the right letters, just not the right order, but performance management and quality improvement. And what I love about this is that it really relates to not only public health, but I think, the general public can understand this as how it relates in business. And so even though we're our nonprofit public health, we still have to think like a business, and we have to think strategically, and we have to think about limited resources and where we're going to put them. So we've chosen this year to go along with all of these other projects, the community health assessment, the community health improvement plan. We have to have a project as well that measures our improvement around a certain area. And we have chosen, I'll let you do the big reveal.
Yeah, so we decided to work on health equity and COVID-19. So we've done so much work this past year in regards to health equity and COVID-19 that it just made sense to formulate it as a performance management and quality improvement project. So we strive at the division to do a PMQI project every year. Sometimes we do departmental projects where, welfare will choose a project, and so will community health, and we'll also do our own individual departmental projects. This year we banded together because this work really was cross-departmental, and we had an all-hands-on-deck approach to COVID-19, so it made sense to have an all-hands-on-deck approach to our performance management and quality improvement project. So this is exciting because we can really talk about, what the data showed us at the beginning of the pandemic, which was that people of racial and ethnic minorities were being disproportionately impacted by COVID-19 and also the adverse health impacts from COVID-19. So we knew that at the beginning of the pandemic, and what we were able to do was take action and take strides to reduce those disproportionate impacts and decrease morbidity and mortality in those groups. So now we're at the fun part where we get to evaluate those actions that we took and say, hey, did we make a difference? Did we decrease morbidity and mortality in our Black, Indigenous, and people of color populations? So that's really like where I come in as the epidemiologist to pull together that data, figure out, where the gaps are, who we haven't addressed, who's being left out, what we can do differently. And then that'll just be a reiteration. So it's a plan, do, study, act cycle where we planned what we were going to do based on the data. We acted and did some action steps. Now we're studying and seeing the impacts of those. And then we'll act again and reflect on what's still needed in the community.
Right. So it's similar in a way how that work just keeps informing itself. It's a big cycle, and we have that diagram that's been playing behind us. So it does kind of show us, we're just going in a circle.
Yeah.
What I like about it too is it helps us really work with intention in the agency and really focus our efforts. We've brought on community health workers, for example. We have many more languages than we did even 6 months ago being spoken in our division. We're working on strategies to really reach, we already had them pre-COVID to reach people for testing or during COVID, and now we're really talking about vaccine, which is my transition, Angela, into vaccine clinics and being intentional because we are in the midst of starting clinics. They have started. We've had hospitals immunize or vaccinate, I should say, their population. And so that's really very helpful to make our community safer and healthier. And so now we're in phase 1B of immunization. And again, we have a graphic that you could pop up so people can see if they are ready to be immunized. If you're greater than 65, if you're medically vulnerable, that's 2 or more chronic conditions, residents and staff of residential facilities, corrections officers, and first responders and health workers not already vaccinated. So basically phase 1A and phase 1B are going on right now. At Public Health, we're really trying to intentionally reach some of those vulnerable populations using our health equity project as well, and really reaching out into some of the agencies that have good connection with these populations.
Yeah, so 10% of all vaccine in the state of New Hampshire is allocated towards racial and ethnic minorities. So we can use that to service those populations and decrease the adverse impacts.
Yeah, so we just want to let people know that it's good news. We have vaccine, and they're safe and effective. They do not give you COVID-19. They're free. And the number of doses you need right now is 2. Those are the vaccines that are out right now. There are new ones coming out on the market soon. So we just say it depends on which vaccine you get. And what we're seeing is that vaccine really prevents serious illness, and that's really important. And as we get more and more people vaccinated, we're not over the hump yet, so we still want people to wear their masks and continue social distancing and safe practices of good hygiene, washing your hands and staying home if you're sick, and getting a COVID test if you need it. So if you want more information, you can sign up for a vaccine. If you're qualified, you can call 211, or you can go to the website vaccines.nh.gov. That's all we have, but we're so busy at Public Health now, and it's exciting that we're able to bring back some of this other work. It's kind of been brewing in the background. I know you never forgot about it, but I'm learning a lot about it really fast. So it's great that we are able to do that, and hopefully, as the pandemic maybe declines, our other work will be able to pick up at a nice pace, and that's what we're hoping for. So thank you for joining me today.
Thank you, Jane.
And thank you all for tuning in to Public Health Matters. And again, if you are in need of a COVID-19 test, we do have a testing clinic on Tuesdays from 3 to 5 p.m. at the National Guard Armory, 154 Daniel Webster Highway. Stay safe, everyone. See you next week.